Hello, everyone. My name is Dr. Charlie Starkman. I'm the Assistant Director and Training Director at Counseling and Psychological Services at the University of Michigan-Dearborn. I'm going to be giving a brief presentation today on navigating after trauma. As we know, almost 2 weeks ago now, there was a mass shooting at the Michigan State University campus, and this undoubtedly brought up numerous emotions: anger, sadness, emptiness, helplessness for all of us, all common emotional responses to a significant life trauma. And in today's presentation, I'm going to be talking more about what trauma is, the different ways in which we react to it, and how we can cope in the face of such traumatic stressors. To start, we need to look at what is trauma. There are many definitions of trauma. I find this one to be one that is very digestible, and that is the lasting emotional response that often results from living through a distressing event. And we know that right now we are living in, and we have been for the last several years, very unprecedented times. Um, we continue to live through a pandemic, an epidemic of mass shootings in this country, police violence, political unrest. It's all happening, and we're all living through it every day. And those are just several examples of what trauma can look like. And keep in mind that we don't have to directly experience one of these events for it to still affect us and to be considered traumatic. It can just happen through witnessing violence in some way, a serious accident, perhaps a natural disaster, climate change, sudden loss, whether that's of a friend, a parent, a classmate. Trauma can also come in different forms. So when we think of how trauma presents, it can be acute. So that means one single incident. Trauma can also be complex or chronic, which means a long-term pattern of witnessing or experiencing a distressing event. So one example of complex trauma might be being raised in an environment where there was constant exposure to or experience of domestic violence, physical, emotional, or sexual abuse, living in a war zone and being exposed to combat. These are things that happen over time. And trauma affects us in many ways. Our physical boundaries and our sense of safety, our sense of self and really being connected to who we are, as well as our ability to regulate our emotions and emotional responses to different situations, and how we navigate our interpersonal relationships. All of these different life domains are impacted by experiencing trauma in our lives. We respond, all of us, in many different ways to traumatic events in our lives. Some common examples are feelings of shame, helplessness and powerlessness, intense fear, anger, anxiety, depression. So many ways in which we can respond to these events that impact all of us so greatly. And it's important to keep in mind that a traumatic event for one person and how they experience that does not necessarily mean that another person, even close to them, experiences it in the same way. So that's something to also keep in mind when we think about trauma reactions, and how we keep, how we observe other people responding. Everyone responds in a different way. I also want to talk about vicarious traumatization. This is something that we, again, are consistently experiencing in this day and age, and I thought it necessary to discuss this. Vicarious traumatization is indirect exposure to a traumatic event, either through a firsthand account or someone's narrative of a traumatic event. And this can also be referred to as compassion fatigue, especially when we are kind of putting on that empathy hat, as I like to call it, and listening to very painful and difficult stories or experiences that someone is sharing with us. And this starts to impact us over time. It accrues over time. And so this is a moment where I'd like everyone to, watching this, to think about the times that you have provided support to loved ones, family, friends, colleagues who have experienced trauma, however they define it, over the entire course of your life. And when you think about that, think deeply about just how many things come to mind. A friend navigating the loss of a parent, a family member learning that they have a terminal illness, a colleague experiencing severe academic stress to the point where it begins to impact their mental health, the dissolution of a relationship, all sorts of things that build over time. And when we have to be there and show that compassion and empathy, it starts to wear on us. And it can result in high levels of stress, anxiety, and fear. And I want to stress that all of these are normal and valid responses when exposed to the trauma of others. These are evolutionary and adaptive functions of how our mind and body are designed to respond when faced with these types of traumatic stressors. And this is by no means an exhaustive or full list of the different signs of vicarious traumatization, but some include nightmares and other intrusive thoughts or flashbacks, social withdrawal, becoming very isolative, being hyper aroused or extremely vigilant to safety and being uncertain in one's environment, as well as that exhaustion, a result of fatigue and a loss of motivation in different areas or functioning domains of what we have to carry out in our day-to-day lives. So I've broken down some of the different signs and reactions to a traumatic event into four different domains, four different areas. So trauma affects us in all sorts of ways, and we feel it in our body, we experience it in our mind, it comes through in our emotions and our actions. So I'd like to start by briefly discussing the physical signs and reactions to trauma. We often hold that pain in our chest, in our head, and as a result, we might start to experience chronic headache, chest pain, maybe a tightness in the chest, rapid heartbeat. We might feel very fatigued, very exhausted. We might feel very tense, also hold a lot of tension in our muscles. We might experience distress in our stomach, nausea, sometimes vomiting, and just a general sense of weakness in the body. And these are all signs that our nervous system has really kicked into gear as we try and cope with a trauma. We also respond to traumatic events cognitively. And these are different symptoms that might occur, as previously mentioned, nightmares, flashbacks, intrusive thoughts. We might also become hypervigilant and extremely aware of our surroundings. We might even avoid certain places, certain people that might remind us of a trauma. Oftentimes people realize that they have difficulties concentrating and focusing. Their mind is elsewhere. They might struggle to be present as well. Some emotional responses to traumatic events include fear, naturally, guilt, anger, denial, sadness, a sense of overwhelm, and strong emotional responses that might be out of character. All or some of these might be present, and occasionally a person might experience, a complete shutdown and feel emotionally numb. Right, it's another form of an emotional response. And our behaviors. People will often withdraw, become isolative, oftentimes to cope, either to self-soothe, to numb, to experience something. There might be an increase in substance use, self-harming behaviors, changes in appetite, difficulty sleeping through the night, especially frequent waking associated with nightmares, especially, and a feeling when one wakes up in the morning that their sleep was not restful. So we can see, again, taking all of these together, that our reactions to trauma are not just just localized in one area. Trauma affects us in so many different ways. There we go. So we have a sense now of what trauma is, the different ways that we react and respond to it, and how we can also be impacted even just by hearing about the trauma that others experience. And I want to list out some important ways in which we can cope with grief and trauma, which in the light of events in the past 2 weeks, I think is extremely important. I want to stress that in this moment, it is so important to utilize your social support network, friends, trusted family members, colleagues, professors, maybe a therapist, being able to just talk through what you are feeling can be so helpful. You want to also engage your mind and body. There's such a strong mind-body connection that we all have, and this is heavily impacted when we experience a traumatic event or stressor. So, maintaining, if you already do, a daily exercise or mindfulness regimen can be very beneficial. Generally keeping up a daily structure, staying busy can definitely help, while also allowing yourself time to feel lousy. And feelings during this time can definitely be unpredictable, intense, and unpleasant. And you need to be able to give yourself time to acknowledge that there is pain, and the feelings that come up are going to be strong. And you want to also allow yourself space and time to rest. Your body needs to heal and recover. You need to engage in healthy forms of relaxation, whether that might be deep breathing, that might be engaging in a yoga practice, that might be progressive muscle relaxation, which involves tensing and then relaxing different groups of muscles in the body. You want to make sure that you're just tending to those needs and allowing yourself to heal and rest and relax. And I'd like to conclude by talking about seeking help and support and just how important this is. If your distress after experiencing a trauma continues for more than a month without the different symptoms or reactions that I described abating or decreasing in severity, and you notice that your daily functioning is impacted, so that might be academic performance, your physical health, your emotional well-being, that might be a time to recognize that you need additional help beyond just your standard support network. And we at CAPS are here for you. We are here to support students in the aftermath of significant trauma. And our services are free. You do not need insurance to use CAPS. Our services are confidential. If you seek out therapy at CAPS, it does not go on your academic record. No one knows about it unless you choose to tell them about it. We recognize the broad array of identities that our students possess, the beautiful diversity of our campus, and we provide culturally sensitive care, affirming care to all who come through our doors. And we are located at 2157 University Center, the second floor right next to the START offices. We are open Monday through Friday, 8 a.m. to 5 p.m. If you have any questions or would like to get set up with an appointment, you can email us at umdearborncaps@umich.edu, or you can come and see us in person to ask more questions, to potentially fill out paperwork or an assessment if you'd like to get started with us. And I've also included the number for our after hours crisis line if you find yourself in an emergency situation. And with that, I am going to conclude today's presentation. I appreciate everyone tuning in and listening, and please don't be afraid to seek out our support at CAPS. We are here for you. Thank you and have a great day.